If you've had open heart surgery like our little hedgehog friend Giffy here, you know how hard it can be to get in and out of that bed. It's hard because oftentimes after open heart surgery, you're not allowed to use your arms and you're not allowed to push or pull or do a lot of things with your arms. So it's challenging to get in and out of the bed, especially if it doesn't go up and down. So how do you do it? Well, in this video, I'm going to show you some techniques on how to get out a little easier. I'm Dr. Sean, your PT guy, and our videos help you learn how to move better and stay independent so you can enjoy your life. Let's get started. Disclaimer! So after open heart surgery, you want to make sure you're keeping your sternum or your chest bone safe and secure. Oftentimes, the hospital will give you like a heart pillow or something to hold onto when you're getting in and out of the bed or even up from a chair, so you're not pushing hard on your arms. If you push hard, your pecs pull on your sternum and that chest bone, and it just kind of pulls, and we don't want any kind of pulling or anything like that. We want it to heal up. So I have my orange pillow, and what we do first when we're going to lay down is you're going to hold it next to your chest like this, okay? You're squeezing this down. And if you have a heart pillow, that's fine. Sometimes they give you tubes even to put your arms in. Either way, I'm going to show you with the pillow. What you do when you go down first is you have to squeeze that pillow, and what we're going to try to do is, here's the bed, here's my head, and here's my legs. We're trying to go down on our shoulder first. The shoulder, the left shoulder, or if I'm on the other side, the right shoulder. But we're going to come down on the side, and the legs will naturally come up. You see that? Because of the leverage. So we're using leverage to our advantage and gravity to our advantage. So what do? We hold this pillow against our sternum really tight, and I'm going to go down on my side. I'm not going to land on my elbow. I'm going to go straight towards my pillow, which is important. Make sure when you're sitting down, you're up high enough in the bed. You don't want to be too low, because then you're going to have to shimmy up. That's going to not be very helpful. So right here, I'm going to come down on my side, and there we go. From here, I can walk my legs back a little bit, and then I start with my knees, and I bring them, and I'm like this. Now, if your bed goes up, it's a great time to put the head of the bed up, because you're going to be really winded when you get to this position, because you're laying flat and your sternum just doesn't feel the greatest. So when we're getting up, you want to keep that pillow close by, and we're going to bend up our knees first like this, one at a time, and then we're going to roll on our side. But before I do that, I grab my pillow, I'm going to hug it, I'm going to squeeze it tight so I keep my sternum nice and safe. And what I do is I'm going to start moving my body over by my knees. When I pull up my knees and I dip them this way, my body starts going. It's like taking the bull by the horns. So we're going to bring the knees over on my side. Good. And then from here, I'm going to tuck my feet right up close to that edge. Okay? And what I'm going to do is I'm going to drop the legs off, and I'm going to drive this right shoulder of mine, the one that's on the top, I'm going to drive it forward, not straight up, because if I drive it straight up, I'm not going to be able to get enough leverage and momentum to come and sit up. It is helpful to have someone standing in front of you when you do this to guide you and to help kind of bring the shoulder forward when you do this. But it's going to look like this. So I'm going to drop the legs off, and on the count of 3, I'm going to rock. 1, 2, and then on 3, I drop them off and I drive my shoulder forward and I sit up. Watch. 1, 2, 3. Excellent. And then make sure both feet are on the ground, and there you go. Now, I kept a hold of my nice pillow right on my sternum, kept it safe, and my elbow did push slightly on that side just to give me a little bit of a push up, but I really didn't push hard on any of my arms, and that's the key. You got to drop those legs down and drive that shoulder forward when you come up. What I see most often happen is someone drops the legs off, and then they try to come up after that, and it won't work because it has to be at the exact same time. Okay, so let me show you all of it one more time. Going back in the bed, I hold it, I squeeze, and I'm in a pretty good position. I'm going to rock on the count of 3. I'm going to land on my shoulder. 1, 2, 3. Legs are up. Bring them back. Bring them over like this to start over there, okay? And then you're there. How do you get out? You bend up your knees. You rotate the knees over to start, okay? And then you tuck them so that the feet are right on the edge. And then you're squeezing this pillow. And again, I'm going to rock forward, okay? And on 3, those legs come down and I drive my shoulder forward and my left elbow can give a little bit of a push. It's going to be okay if you do that. So 1, 2, 3. There we go. So that's how you do that. So now you know how to get in and out of that bed a little bit easier after open heart surgery. Just make sure when you're doing the technique you don't roll too fast and get a little overzealous because you don't want to end up having a fall. Speaking of falls, if you want more tips and training on how I teach people to prevent falls, you can get that down in the description in the link below. And if you want more videos just like this one to help you learn how to move better and stay independent to enjoy your life, click the subscribe button down below and we'll see you in the next video.